After 2 miscarriages, I was diagnosed of uterine fibroid. I was so scared after several doctors offered me surgery because that's the only solution to my problem. A friend of mine had 2 surgeries, but the fibroid grew again. I just visited Dr. Marina's clinic and I successfully conceived after she treated me with her natural herbs without surgery. And now I am so happy with the baby. My sisters, at Dr. Marina's clinic, her medicine really works.
Hello viewers! Today we are continue cycle of our programs about the disease which can be difficult to detect and which doesn't give any symptoms. Today we will discuss about the kidney stones. This is the conditions which is just develop inside in the kidney and give a lot of impact to the body and even they can cause the death. This condition which is result of metabolism inside in the body. Stones, which is the crystals, which can be developed like some of the mineral like a calcium plus additionally acid with the chemical reaction develop the crystals. And independent of the type of acidity, it can be a different and create a different structure. It can be urates. It means it is just calcium and uric acid, which is just automatically create in the human body when we take a lot of food which is contain substances which is called purine. And when we are eating that food like black tea, black coffee, we take tomatoes, we take a lot of chicken, we take vegetables like spinach, like cauliflower, we take, it is vegetarians, but when we are taking it, it is a huge quantity of that purine inside. And when we eat, liver automatically transform it to uric acid. And this is the very important points coming, that when uric acid is just produced inside in the body, our kidney, which is just supposed to control liquid inside, must take it out. But something happening inside, but not all the uric acid coming out, and that chemical reaction happening and crystals develop inside. We are talking about one type of the crystals, which is urates. We have another type of crystal, which is oxalate. This is most hard crystals, which can be monohydrate calcium oxalate or just calcium oxalate. That chemical reaction coming with the hyperacidity with a different type of the acid. And the crystals which is developed, especially like monohydrate calcium, which is located inside in different organs of our body. It can be inside in the blood vessels in the heart and blocking the way for the blood flow. It is start to cause hypertension, high blood pressure. It is make swelling of the legs, but because their blood couldn't flow normally and the legs is coming bigger, and we call not cholesterol plaques like everybody start thinking. It is just develop the crystals of that monohydrate calcium. This is very dangerous combination which can be developed and create and cause a lot of troubles, because that particular stones, it is not detectable on the X-ray and very difficulty detectable with the ultrasound scan and very difficulty detectable with any other, like how they tell it, it is not X-ray contrast. It is difficult to detect, but what they are doing to our body, it is so dangerous. And when it is created, nobody understand and nobody believe what is going on. The third type of the crystals, it is just oxalate crystal. When it is proper oxalate crystals, it can be detected with the X-ray, with the ultrasound scan, it is easy detectable. Then we have another type of the crystals which is called cystine. cystine crystals. It is another type of the crystals which is just created inside in the kidney. It can be inside into another organs, but mostly create in the kidney, ureter and urine bladder. It can be different type. I calculate and detect like 33 type of the crystals which are available to develop inside in the human's body. And how we just notify and see that most popular I mentioned, and another it is possible the same they can be created inside. We are talking today about what can be created inside in the kidney, because we have another stones which can be inside in the gallbladder, which have another stones which can develop and create inside in our digestive system, the colons, which can be even make obstruction and necessary to do surgery. And it will be another crystals which can be inside under the skin, which can be inside in our joints, and it is a multiple crystals which can be developed inside, but all of them is result of metabolism. Why we are discuss about the metabolism? How the crystals develop? Crystals develop, all the crystals and stone mostly develop in the conditions when it is acidic flora. To have hyperacid inside in the kidney, it is mostly a result of the metabolism inside in the digestive system. We have hydrochloric acid already in the stomach, and when the people additionally take additional citric fruits, juices, different type of the oily and fried food, different type of the food with a huge quantity of the purines, plus additionally all that metabolic and metabolite which is after the digestion supposed to move out through the kidney and through our colons. If it is not breaking down so well, it is develop and create. If liver and the bile secretion is not giving enough bile, it is create the condition of the hyperacidity. If pancreas doesn't produce enough pancreatic juice, it is create hyperacidity. Plus additionally, if the people start feel joints pain, what they are taking? Additionally calcium to treat their knee problems or to treat their bone problems. It means they additionally add the minerals and the acid which supposed to create and develop the crystals inside in the body. Where the body will store that crystals? It is just independent of their acid. If it is the acid, how we discuss about the oxalate, it is just will be stored inside in the blood vessels and inside in the soft tissue. If it will be urates, urates will be stored inside in the joints, and we have like uric arthritis or gout, or it can be stored inside in the joints that we have uric arthritis. It can be inside the neck, elbow, hands, just fingers. We talk about arthritis, and nobody understands that if you change your diet, all that symptoms will go, that you need to always control your food, because metabolism, it is just how our stomach and our internal organs digest the food.
Some time back I had fertility problems. I experienced a number of miscarriages. Due to that, I had to visit the hospital. I was told I had fibroid. I visited several hospitals but never had solution to my problem. One day I was watching the telly, I saw Dr. Marina's program on the TV. I picked a number and I called. I visited her, and honestly, she cured my fibroid without operating on me. 2 to 3 months later, I discovered I was pregnant. And thank God, today I also have a very beautiful baby girl.
My dear ladies, any woman who has difficulties with fibroid, Dr. Marina is here for you. I've been having fibroid for so many years. I've been to so many places, hospitals, and even conducted operations. But after I visited Dr. Marina, everything is over now. In fact, even I didn't have a child back then. By the grace of God and the special grace of Dr. Marina, I've been able to have a baby girl as I'm speaking to you right now.
The next point which can create the kidney stones, it can be dehydration. It means if we stay in the tropical environment or in hot weather, during our day, we're supposed to take like 1.5 to 2.5 liters of the liquid of the water to protect dehydration of the body. Because our kidney is taking the liquid out. Plus additionally we sweat and the skin take the water out. And it is common condition when the liquid inside in the body, it is just start reducing. And concentration of the salt which is inside in the kidney, it is coming higher and higher. Smaller water, higher concentration of the salt. And it is make and create conditions when the small crystals, like a small sand, then it is start attract and make assimilation different of the crystals and create the stones. Small stones can be just easily flow to ureter, to urine bladder, and through urethra pass out. But when the crystals start grow bigger and bigger, and when they start flow through ureter, the size, for example, like 3, 4, 5 millimeters, because the uterus size is 6 millimeters. Plus additionally, some of the places can be narrow or it can be bigger. And this is when the crystals is flow. The crystal has a rough ends of the crystal, and when it is flow through the ureter, it is scratching inside, and the patient has very severe pain. And that pain nobody can stop even with the medication till that time when the stone is completely gone through ureter and jump inside in the urine bladder. Then the next step, when it is going through the urethra, it is the same scratching the wall, and like result can be blood inside in the urine. We just can discuss about the different points. And the next point, how it can be detect presence of the kidney stones in the body. How the kidney stones can be detected? Number one, when you are coming to medical facility, you need to do the full blood count test. This is like everybody usually, and need to detect. That test will show presence of the pathological process, presence of the inflammatory process, and it will be shown that how the kidney functioning. Second lab test necessary to do. This is the urine test. And urine test microscopy will show, do you have any of the crystals or amorphous stages of the crystals inside in the urine. It can be different type of the crystals which can be detected there, and this will be the signal that the small crystals is already present inside in the urine tract. It means inside in the kidney. And the last point, it can be done ultrasound scan. And additionally, it can be, if the scan is just detect and show the presence of the stones, size of the stones can be detected on the MRI or CT scan. When we can see location of the stones, we can see the size of the stones, and if it is an X-ray contrast, that we can see how will be better to remove the big stone from the body. I will advise that necessary to detect it earlier, and how the people can know that need to take attention that possibility presence of the kidney stones. Number one, if you are eating the food and after that you feel like belching and burning sensation in your epigastric area, it means you have hyperacid. It is a condition when the crystals develop. Second point, you can start feel like the heart burning sensation and the heart is beating fast, or it can give like pinching inside in the heart. You need to take attention, maybe it is some of the monohydrate calcium start develop inside and give you that troubles. If you have high blood pressure, it will just indicate or problem with the heart, or problem with the blood vessels, or it is a problem with the kidney, which can cause your high blood pressure, and that crystals which is just developed and block the way for the blood flow normally. Plus additionally, when the crystals develop, it is just affected flexibility of the blood vessels to react for the outside atmospheric weather and atmosphere pressure that it's supposed to control our BP in the normal condition and normal range. Additionally, you just can take attention if you start feel burning sensation in your food. It is advised and just indicate that some of the burning sensation it will start like hyperacid creating and present. Additionally, if you are sitting and you feel like inside in your knee, from one side and to another side, like a little bit burning or some of the pinching is just coming inside in your knee. If you start feel like sometimes your skin is itching, sometimes it's not itching. And again, itching and not itching. It means some of the acid after your food, after metabolism, something going wrong. Hyperacidity coming and some type of crystals is just elevating up and develop and create that burning sensation, because when the crystals start accumulate to each other, it is pushing the soft tissue inside and develop the pain. This is you need to listen in your body and you need to take attention what is going on. If you feel any of these symptoms, I will advise go to the doctor or go to any of the medical facility, or you can visit our medical facilities in Ghana or in Nigeria, and we will help you to detect what is going on and see if it is a kidney stones. We have a natural remedy to give to you to dissolve the kidney stones in a short period of time.